Did you know that Medicare prescription drug coverage now has a maximum out-of-pocket limit on all prescription drug costs tied to you? Well, it's true. Starting January 1st of 2025, the Inflation Reduction Act went into effect in the aspect of the $2,000 maximum out-of-pocket cap that all Medicare prescription drug insurance companies have to abide by. This includes standalone Part D prescription drug plans if you have a Medicare supplement plan. It also includes prescription drug coverage that's built into a Medicare Advantage plan. So if you have any type of Medicare prescription drug coverage, you now have a mandatory maximum out-of-pocket cap of $2,000. If you've been on Medicare for any extent period of time, you probably know that Medicare prior to that never had a maximum out-of-pocket limit. In fact, Medicare always, for 20 years since Medicare Part D went into effect, had a systematic aspect of the coverage to where the more you used it over time, your coverage amounts that you'd be responsible for would fluctuate, right? That is what the donut hole was all about, also known as the coverage gap. When in that aspect of the plan, the more you used your coverage, the faster you would get into the donut hole, and the percentage of costs that would be passed down to you on your prescriptions would rise. Well, that was all eradicated and changed with the Inflation Reduction Act taking effect in 2025. But year in and year out, those numbers on what the maximum cap will be will fluctuate a little bit and change. And they have announced what the new numbers are going to be for 2026. Hi, my name is Christian Brindle. I run a company called Everything Senior Insurance, also known as Christian Brindle Insurance Services. We're licensed in 46 states to help you out with your Medicare health plan. We cost nothing to be able to work with you on. We also have no obligation if you want to give us a call and get a free consultation this coming open enrollment period. Our office number is 801-255-5340. Again, 801-255-5340. You can find all of our contact information down below in the description. But it's true that the new maximum out-of-pocket cap that all plans are abide by will change a little bit from year to year. Now, a couple of aspects and details that you need to be aware of. In order for this to apply to any medications that you're taking, it has to be a prescription that's covered under the plan's formulary. Okay, so that means if it's in the plan's formulary, it's a prescription that they cover. Not all prescriptions are covered under any plan's formulary. There is no Medicare Part D plan that covers every prescription that's available. Okay, they have certain prescriptions they cover. They also have certain prescriptions they don't cover, and they might be missing from the plan's formulary. So it has to be a prescription that is going towards the plan's formulary and a prescription that the plan is helping pay for. In addition to that, if you're getting the prescription through another method, sometimes people on certain medications will elect to use free coupons such as GoodRx or SimpleCare instead of running their prescription through their Medicare Part D plan because they get a better cost. No qualms there for me. I think that's a great thing to do if you can get a better cost with a free coupon. But that cost of that prescription that you pay after the coupon will not go towards your $2,000 cap. Why? Because it's not going towards the insurance. It's not being ran through the insurance, so it's not included. Same goes if you get your medications through a Canadian pharmacy like Maple Leaf Meds or another type of Canadian pharmacy. So in order for this to apply, it has to be ran through, number one, the insurance company, and they have to be processing it as a claim. Remember, you can't use coupons with the insurance. It's one or the other. And the second thing is it has to be a prescription that's covered on the plan's formulary. So while in 2025, that maximum cap on all Medicare prescription drug plans was $2,000, it's going up ever so slightly to $2,100 in 2026. So be aware of that. Now, one thing that will be coming out over the next couple of months is the new Medicare Part B premium. Everybody on Medicare pays the Medicare Part B premium. This year, in 2025, at the time of recording this, it is $185 per month. It's higher if you have a higher income. They charge you more for that. They call that IRMA, Income-Related Monthly Adjustment. Or if you are in a low income bracket and you're on food stamps or Medicaid or something like that, your state, in the form of Medicaid or Medi-Cal if you live in California, can be paying for your Medicare Part B premium. But aside from those two extremes, everybody pays the same premium for the Medicare Part B premium. A lot of people have it automatically withheld from their Social Security check, and it's kind of out of sight, out of mind. People forget that it's coming out. People forget also that it goes up every year. Those new numbers will be changing and officially coming out over the next couple of months. And the numbers with the Medicare Part B deductibles, for those of you on Medicare supplements, will be coming out as well. So we'll be reporting those changes on this channel for you. I hope you found this video helpful. I hope it answered your question and kind of explained what this maximum out-of-pocket cap on prescription drug costs was all about, where it came from, and the history of it. If you found this video helpful, insightful, do us a favor. Smash the like button for the YouTube algorithm. It's going to help more people like you who are confused and need to find this information find it easier. Again, reach out to us. We're licensed in 46 states. If you'd like a free, no obligation consultation on your plan, one of our licensed, very well-trained and professional team members will be happy and on standby this open enrollment to help you before December 7th deadline. We appreciate you watching all the way to the end. Make sure to subscribe for free Medicare and health insurance information on a consistent basis. And happy Medicaring, everybody.